Hello, it's Dr. Rhonda Johnson, and today is Thursday, January 13th, 2022. Now, today I'm going to be talking about what the experts have said about your risk of getting Omicron and what you can do to avoid it. This week we heard the acting FDA commissioner, Dr. Janet Woodcock, and Dr. Anthony Fauci say that most people are going to get COVID, and that was from the experts. I would venture to say that most of us did not want to hear this. So at least now we know how widespread this Omicron situation is. And I'm posing the question, what can we do to try to protect ourselves? Well, I have a few suggestions. Again, these are just general suggestions, and this is my opinion. First, don't panic and do not feel hopeless. And folks, don't have an Omicron party, because even though experts say Omicron is milder in terms of serious hospitalizations being prevented, we do see a lot of folks going to the doctor's offices, urgent care, emergency rooms, and hospitals all across the nation are filling up with COVID patients. So please don't go out there trying to get COVID, because you might get more misery than what you expect. And remember that the treatment is very limited. The antiviral pills and the monoclonal antibodies are extremely scarce, and they're reserved for only the sickest people. Second, assess your risk factors and plan your activities accordingly. Experts say this surge will last another 3 to 4 weeks for most of the country. You know your age and your medical history, common risk factors for COVID. So for the next 3 to 4 weeks, if possible, change how you do things. Wear well-fitted masks for people 2 and up. Double your mask if you don't have an N95, but make sure you can breathe. Maximize your air opportunities for clean air. Use a HEPA filter, provide fresh air ventilation to your residents. Stay your distance from other people. Experts say the virus loses 95% of its infectivity within 5 minutes in dry indoor air. And then the common things: get enough sleep, rest, do your activities outside. Make sure you have enough medication and basic staples. Stay active, take your vitamin and your mineral supplement. Get boosted and or vaccinated if you believe in the vaccines. And then thirdly, know the symptoms of Omicron infection in kids and adults. And if you have these symptoms, assume you have Omicron, isolate, and get a COVID test at day 5. You know, you might be able to manage Omicron at home. You know, the emergency symptoms are high fever, difficulty breathing, chest pain, inability to eat, drink, lethargy, confusion, and whatever you are experiencing that is abnormal. So plan ahead, be prepared, and stay safe. That's my message today. It's Dr. Rhonda Johnson, and my views are my own.